So what is the function of the phospholipase? Phospholipase, it is causing the lysis of the phospholipid. We know one thing, that the phospholipid is the main component or very important component in any cell membrane, okay, in any cell membrane, in any human cell membrane. So phospholipase, what it does is it is causing lysis of the cell membrane, and which will lead to the cell membrane damage. Now in normal cell, suppose this is normal cell, we know in reversible it swells up by building H2O or water inside the cell. But in phospholysis, what happens, the cell membrane got damaged, means something can go in, something can go out, okay. So what is important to know this, suppose there is an antigen, specific antigen present in heart or lungs or liver, okay. If there is a if there is injury, if there is any kind of a symptom, we are seeing that the lung is having some pathology. There we know lots of enzymes which are specifically present in lungs, which are specifically present in liver. So we do those enzyme test, because if those enzyme will be found in the blood, that means that the membrane of the cell is damaged, then the membrane of the cell is damaged, and this is very bad sign, this is very bad sign. So the cell will swell, this is normal, reversible, remove the stress, it's fine. But if the enzyme is visible outside, we can find enzyme outside, that means the cell membrane is damaged, that means the phospholipase is activated, and this is irreversible cell injury, okay. This is irreversible cell injury. What are the signs here? Let's revise the reversible and irreversible cell injury. So this is suppose reversible and this is irreversible, okay. In reversible, the main sign was the cell increasing in size, due to what? The main cause is increasing by the deposition or the attraction of the attracting water, okay, attracting water. Whereas here the membrane is damaged, there was a stage when the cell was normal. In reversible also, there was a stage when cell was normal, then cell swells, and now the cell damaged, the membrane damaged, okay. Now the membrane damaged, there is no cell membrane damage, there is a cell membrane damage, okay. Enzyme of intracellular enzyme will not leak out in the blood, but in here reversible, the enzyme will be leaking out, enzyme will leak out, okay. Very bad sign, very bad sign. Enzyme level normal in blood. So suppose any enzyme, we are talking about the same thing. Suppose in heart there is an enzyme like troponin. Let's see, for example, in heart there is a troponin. Suppose the troponin in normal human also, there is a little bit amount of the troponin which can be found, but in irreversible, the troponin will be higher. The leakage of the troponin is lot more in irreversible because of the cell membrane damage. So the troponin level will be very higher than normal. Okay. So the enzyme level will increase. What if we talk about continue with the heart? What may be the reversible cell injury? Maybe angina, okay, maybe angina, just chest pain. What may be reversible? It is myocardial infarction, MI, okay. In clinic this is the main diagnosis, to see if this is reversible or is this irreversible, to do the enzyme testing, because we know this, that if the cell membrane damage is there, then enzyme will come leaked out, and if not, then it's a good sign, it is reversible, okay.